I'm Dr. Michelle Murphy. I'm one of the cardiac electrophysiologists here at Kootenai Heart Clinics Northwest. Thank you for taking the time to visit with us today. We've created this little video to help prepare you for what to expect after you've met with your doctor and decided to have a device implanted. Once you've met with your heart doctor to discuss what type of device you actually need to have implanted, there are a few things that you need to remember. The first thing before you leave the office, we'll actually have you sign a patient clinic agreement form. And this form is really designed to help you understand what's involved with deciding to have a device placed and also ensure that you come to your follow-up appointments. There's an appointment 1 week after your device gets implanted. This is a visit with one of our nurses to check your wound to make sure everything's healing okay and to ensure that you've felt okay after your surgery, and also to check your device to make sure the wires and everything else is performing to what we expect it to be. Then you'll have a 90-day visit with one of our providers, either with myself or one of our other cardiologists or one of our nurse practitioners. And the purpose of that visit is really just to make sure, again, things are going as smoothly as we expect them to be going, and also to check the performance of your wires to ensure that they've matured and they're secure in the heart.
Hi, I'm Jeanette. I'm the one that'll be scheduling your surgery. I'll either speak with you in person or I will call you on the phone to set up a date. I may not be able to give you an exact time as our schedule may change. You will get a phone call the week before your surgery to confirm a time. If we have enough time, we'll also send it to you in the mail as well. One of our nurses will call you before your surgery to go over surgery, day and time, as well as to prepare you for your surgery.
Hi, I'm Hillary. I'm one of the nurses here at Kootenai Heart Clinics Northwest. I'll be the one that calls you before your procedure and after to check on you, and also one of the nurses that will check your device in the office after you have the surgery. I will be calling you to go over your medication instructions and when to stop eating the night before, and I'll be sending you out a soap that you'll shower with before the procedure, and we'll review some just general instructions about the procedure and what to expect. Please bring an overnight bag, and you will also need a driver.
So on the day of your surgery, you'll check in at the Heart Center at the appropriate time that you're given. Once you check in, the nurse will escort you back to your room, and this is the room that you're going to spend the rest of the day and possibly the evening in. So once you're checked in, the nurse will have you change into your gown, you'll have your blood drawn, and you'll get an IV. And the purpose of that is so that we can give you medications during your surgery. So once you're prepped and ready for surgery, you'll be taken into the operating room. At that time, you'll have stickers and patches placed to your chest, front and back. And this is to ensure appropriate monitoring during the procedure. Once you're prepped and ready for the procedure, you'll be given medications through your IV to help you relax. Then the doctor will then proceed by giving you local numbing medicine under your shoulder, either the left side or the right side, depending on which side we decide to implant your device. After the numbing medication is injected, we'll then proceed by placing leads into the vein that runs underneath your collarbone. That then allows us to direct those wires down into the heart to be secured. Once they're in the heart, we'll then test those leads to make sure they're in the right place and we're getting the right feedback. And once we've tested those wires, we'll then connect it to the battery. Everything then gets tucked away underneath your shoulder. We place a few stitches, and then you're taken back to your room to recover. You'll stay in your room for a few hours, and depending on how you feel and at the discretion of the doctor, you'll either spend the night or you'll be able to go home later that day. Once you're ready to be sent home, either that next day or the same day, the nurse will actually review with you all of your home medications, when to start back some of the medications, when to shower, and you'll also be given a list of all of your appointments.
If you have any questions or concerns, please call the office. I will be helping you schedule all of your follow-up appointments, wound checks, 90-day visit, as well as your yearly appointments.
After your surgery, I'll give you a call in 24 to 48 hours to follow up, see how you're feeling, how the procedure went, see if there's any issues going on. We will discuss the 1-week wound check visit and what to expect at that visit. We will also plan on following up with you at the visit regarding your home monitoring, how the wound is healing, and just your overall toleration and adaptation to the device. Bring a list of questions if you feel like you have a few to go over with us nurses at that visit. We will plan on giving you a follow-up phone call in 3 weeks to verify that your home monitor has been shipped to you. You have hooked it up successfully and it is transmitting to the office.
Just a few things to remember. Any worsening pain, redness, bleeding, hiccuping in your chest, racing heart rate, or fluttering, call your doctor right away.
Just a reminder, it takes a few weeks for your device to settle in and for you to get used to it. If you have any questions, don't hesitate to call the office. We can usually walk you through most things over the phone versus going into the emergency department. You'll be given an ID card that has your device information on it. Be sure to carry that with you at all times. Thank you for choosing Heart Clinics Northwest. We look forward to caring for you.